Welcome to Positive Philter with your host, Philip Wilkerson, a podcast that focuses on friends, family, health, and career, with a little self-help along the way. Please join me in this journey for self-improvement, and I hope what I have to share will make you a better person, thus making the world a better place. I hope you enjoy the show. I hope you enjoy the show. Oh my goodness. All right. Well, hello, people of the world. I think this is Philip Wilkerson. I need to know my name. I'm here. Let's start it again. I'll just cut it out. Hello, people of the world. This is Philip Wilkerson. I'm here with Haley Parker, a good friend from high school, and we're at the Virginia University of Integrative Medicine, and we're doing a live, kind of video podcast here about alternative medicine and just all kinds of things. But before we get started, Haley, just tell the listeners and I guess viewers who you are.
Thank you so much, Philip. It's so good to see you. My name is Dr. Haley Parker. I am a licensed acupuncturist in several states here in the USA. I work as an acupuncturist, I work as a professor, and I work as the Director of Clinical Operations here at VUIM. We say VUIM for short because it's quite a mouthful. I've been a practicing acupuncturist for over 10 years. I have transitioned into higher education because my passion is in advocating for the profession and having everybody understand the benefits of acupuncture and what this can do for not only your healthcare regimen, but also for the betterment of our population and our health as a whole in our country.
Now, I know you since high school. I don't think we had any aspirations of being doctors and all that. And I knew you was a rock star athlete. When you were, in your high school days being an athlete, did you ever think about a career in medicine or take us through that? Because I was when I found out we reconnected, I was like, wow, Haley's doing big things. But
thank you.
I did not see this in the crystal ball.
Yeah. Well, and I thought the same for you. And I was like, oh, your podcast famous? Wow, Philip. And I met his beautiful children and wife, and it was awesome. It was one of those moments. People ask me, did I grow up thinking I was going to be an acupuncturist? And the answer is no, not at all. In fact, the path chose me, and I feel very divinely guided into this mission. But my athletic career was actually something that brought me to find acupuncture. I was a diver, a springboard diver, 1 meter and 3 meter, from high school on through college. And after college, I had such severe injuries that were being managed throughout my college days, and nothing would take that pain away. Plus, just as we are, we're really not symmetrical as human beings. And so there were certain joints and crinks and cracks that were holding more tension than others. And after college, I was actually working with my grandfather in his aviation business and doing a lot of manual labor that flared up my injuries so bad. He was the one that took me to my very first acupuncture treatment. And I thought, oh my gosh, he's crazy. But I was like, oh my gosh, he probably wants to get me to stop complaining and just, complaining about pain. And really, doctors could only give me so many options: pain pills, some stretching, which of course I was already doing. And so I thought, well, what's the worst that can happen? It could take my pain away. And so I went, and the doctor changed my life. So I ended up working with that doctor part of that summer, interning in his office. It innately made sense to me. I ultimately wound up going to school, and it innately made sense to me. And fortunately, I was given this gift this lifetime of helping people understand there is something that they can do for their health and ultimately take their health back into their own hands, prevent those injuries from happening in the first place, mending and getting your body to heal from the inside out, and ultimately now being a speaker for the medicine to try to get people to understand that there are many alternative therapies that can work in conjunction with your current regimen to help give you the best quality of life. And
do you remember that? I remember now that's what I thought it was lacrosse, but I remember seeing you do dive practice. Because I was a lifeguard, and I was watching y'all do that thing.
Yeah.
You remember that?
Yeah. Well, yeah.
It was at GW Rec Center. It was crazy. So what made I was going back because you already jumped because I knew that it wasn't connected to your major. So you went to UVA.
I went to UVA.
But you studied religious studies and anthropology.
I did.
Which now kind of ties into maybe that spiritual piece.
It does. So I have always been one that has a lot of questions, and I always am very curious for answers. But yes, in my undergrad education at UVA, I studied religious studies and anthropology, and I fell into that as well. My dad was always questioning, Haley, what are you going to do with that when you graduate? and as a very supportive father, he was making sure I was happy in life, right? But he also wanted to make sure that I could pay my bills one day. day. And I was fascinated by human culture and how the ancient societies did practice not only their belief system, but their healthcare practices, their community, their spiritual community. And when I say spiritual community, I mean the parts of our whole health that we take for granted these days. To have a group of people that can intellectually understand you, to have purpose in life, to have financial stability, to have a career and occupational wealth and purpose, right? To have your physical health, but your mental health, your social health, all of that really factored into the total person. And so by studying that undergrad, it made so much sense when I started to study East Asian religions, Indian religions. I was studying Buddhist religions, and I never really thought about acupuncture at that point, but I understood that holistic aspect of what health and human existence should look like based on the tradition. My primary concentration was in Christianity, and my secondary concentration was in African religions, tribal religions, including Islam, and how really the universalism of all these different faiths had these aspects of health and wellness, and how that spiritual health very much factored into that. So ultimately, when you fast forward and you look backwards, it makes so much sense of how acupuncture fits into that. And my dad was so relieved that I had a career path. Yeah. Right.
So you said that, like, even in your classes, did they talk about acupuncture in one of the aspects of your religious studies class?
So it was mentioned, and equally on that other side of the major, I was anthropology, and so in shamanic practices or ancient medicinal, like wellness type aspects of study and culture, we had exposure to traditional medical disciplines, but never were we going down into that rabbit hole of the poetry and the symbolism of Chinese medicine. And what's so cool about that is when I continued my studies into traditional East Asian medicine, those universals that still make sense today. So 5,000 years ago, before the Chinese had discovered this medicine originally, they didn't have x-rays or microscopes to know what the nervous system was or the circulatory system was. But they knew that there was this circuit board of energy that ran through the body. Thanks to modern technology, we now have microscopes and these x-rays and these MRIs and digital imaging to where we can identify the different like fascia and the connective tissue and the bones and how the neurology starts to interact with like the peripheral nervous system, and we can understand what maybe the ancients were trying to say thousands and thousands and thousands of years ago, even passed on from an oral tradition before that we were really able to study the anatomy of what we're doing today. So the overlay is really powerful in the ancient system and the wisdom that they still understand better than we probably do today, but how our Western medical world is able to overlay and explain that to our society and how we can use that tradition to help our population today with their health and wellness.
Now, also, correct me if I'm wrong, didn't you also like go on a cruise and or on a boat and travel the world?
I did. That was kind of self-seeking, but I was an acupuncturist. No.
I thought that was connected.
It totally was.
Okay,
so,
good. I thought I was about to say.
So it was my wanderlust. As far as I love traveling and studying different cultures and different people, and I was so lucky to be an acupuncturist there.
No, keep going.
On the ship. So I worked for Princess Cruise Lines for 5 years. I did 7 different tours around the world. And the beautiful part of that in my personal education of health and wellness and studies of culture was that I could work on somebody from all over the world. And we all came with very similar pain, similar problems, similar patterns of when you have physical ailments, how much that affects your mental, emotional well-being, how that affects your family, how that affects, your overall enjoyment of life, of being able to go on a cruise, to go see, the place that you've been like saving up for your bucket list to go and see. And so ultimately when I was there and I was working with people, so much of what I was doing maybe wasn't even verbal, but it was this transfer of energy and this transfer of understanding and being in that moment, having empathy, being centered on that patient's concern and why that was important to them. Because what we don't remember is that, not everyone's definition of health is the same. Someone's definition of health can be, I just want to go through the Panama Canal and see the Panama Canal. Someone's definition of health is, I just want to be able to enjoy my husband's 90th birthday, right? Or someone else's definition of health is, man, I really want to be able to play basketball with my kid, And so when you sit there and you're like, oh gosh, I never really considered that I take for granted my health until I don't have it. But what someone else's version of health and quality of life is might be very different. And we have to take into account all of that when we're really considering the person. That may or may not have been communicated with English, right? Because I was working with people from, Europe, down in South America, they speak English in Australia, but, all over the world, and how that we're really so much more alike and we're so much more human than we realize. And when it comes to health and wellness, ultimately our bodies are trying to heal themselves. They just get stuck. And if they have a little bit of support and a little bit of help, they typically know how to reroute and redirect. So my exposure on the ships really gave me that ability to see those universals yet in another layer of my own personal education.
Yeah. And so one of my follow-up questions here is, I think we said Eastern medicine, right? And I think I would assume you present as a white woman. So how was that to be like transition learning about East, West? And can you talk a little bit about being in those spaces, like when you started studying, were people like looking at you skeptical and say, why are you here? Think about the cultural aspect of just our American identities in those spaces.
That is a fantastic question. Actually, you're reminding me of something. So when I went to school, I was one of the younger people in the next generational wave of acupuncturists here in the USA. And so when I graduated, I already looked really young. And so people were asking me, oh, am I a real doctor? Right? Because, there is that point in time where you sit there and I'm like, I don't know, I'm still having this imposter syndrome that I really just graduated from school. But then secondly, some people did come up to me and go, oh, but you're not a real Asian doctor. And I thought to myself, and I thought to myself for a second, because at first I would feel a little hurt, but I just want to help you, And then I thought about it and I'm like, but for them, they've never really had that exposure. And to them, they would think that this is a traditional medicine passed down through a family lineage. So maybe I wouldn't have that same compendium of knowledge. Well, then I started to get a little smart aleck and I was like, well, is your pediatrician a child? I don't know. I don't but I started to understand what people were saying, because sometimes we're saying things and that's like the meaning is connotated a little differently. So ultimately, it turned out to be a privilege in my career, because a lot of the times we have these practitioners who have this amazing wealth of knowledge, but they might not connect with the same population base that someone else may connect to. So a colleague of mine can reach a whole nother level of patient than I can. And part of my gifts as a practitioner was that I was able to take this tradition and I was able to try to comprehend it as an American woman and be able to now relate it back to, wait, how does that make sense to me? And how can I communicate that to make sense to my patient? So with that, especially here at the school, we try to teach our students that all of their past lives are really helping them to build their own practice, and the way that they can communicate to their patients, they're going to reach a different kind of patient than maybe their student colleague, and vice versa, right? So we're all given this gift, we're all given this calling, and how can we help more and more people with this medicine, and understanding what brought us to the medicine and how we can continue to preach the healing that our body innately has in itself.
Yeah, one of my another follow-up questions is, now we talked about the skepticism of your fellow colleagues. What about the skepticism of clients? You were my first acupuncture, to be honest. I had the dry needling. There's a difference. Maybe you could explain that difference between dry needling and acupuncture. But what about that skepticism of this is real medicine? I've never been to an Eastern integrative medicine center before. Does it really work, kind of thing?
Sure. That's a great question. So ultimately, I think there is so much research out there, and there has been so much of a movement of people recognizing the power that they have in their health and in holistic healthcare. My colleagues in the medical world, to many people's surprise, most medical doctors, dentists, cosmetic surgeons, spinal surgeons, pediatric doctors, all of them actually, when they find out that I'm an acupuncturist, they want to pick my brain and they want to learn how we can work together on helping to stimulate the body to heal from the inside out. Doctors recognize that their job is in their line of working with a patient. Say a podiatrist is going to work with feet, but they're going to refer to an endocrinologist, or they're going to refer to an ENT for something going on in the head, ear, nose, and throat. So we all understand that we go into such specialized versions of medicine, but yet we still need technicians that integrate and help the body to make sense of all of our other prescriptions. While my colleagues and counterparts are biochemists, typically they're going to be working with the body and using pharmaceuticals to maybe stop an infection or help with acid reflux or give them painkillers to help ease the pain of sciatic, they are going to send them to me to help tell the body how to heal, where to heal, and rehabilitate it so it can help heal from the inside out and the outside in. Now, to say it's real medicine. So ever since the 70s, when Chinese relations were opened up with the U.S. under the Nixon administration, acupuncture needles were given Class 2 device designation, which made it legal to practice acupuncture in the U.S.
The Class 2 was like because they were trying to not do heroin. You know,
there's
saying needles was bad with certain things, so they had to have a distinction for it.
Well, and there's a stigma with this, right? So when we were seeing how acupuncture anesthesia was working for surgery over in China and how it was actually already integrated as part of Western and Eastern wings of a hospital, we brought that over here. And so acupuncture started to be explored, not only with immigration, with bringing the traditions here into our mezcla of a culture that we have in the U.S., but using those Class 2 devices and being legalized, people were getting results. Now, as we know, when the results speak for themselves, right? And if something's going to work and someone wants to get better, they've maybe tried everything under the sun and they haven't tried acupuncture and they get better, people are going to start to talk. But beyond that, acupuncture is part of a bigger system of whole person healthcare. And acupuncture, not just in traditional East Asian medicine, but that's part of still a system of traditional Chinese medicine where we have to remember that we still need rightful thinking. So we can't continue to expose ourselves to toxins and toxic thoughts day in and day out of our lives and think that we're going to be able to heal and meditate over that. We have to remember that nutrition still factors in. We're still organisms that need sunlight, fresh air, sleep, right? So our body can heal and go into rest and digest. Acupuncture's beauty, and what I find with most of my patients in the DC area, is the ability to switch over into the rest and digest or that parasympathetic nervous system where the body is operating under the surface. Probably 85% of our body is working without us having to consciously think about it. And so then our conscious overlay in our brain is able to do what we need to do. Drive on 66 and not get sideswiped, right? Type on a computer and answer emails, be able to have wonderful conversations with old friends. But that underlying nervous system is able to go back down into its mode where in that therapeutic window, the body can heal itself optimally. And it's able to go into that process of rest and digest where tissue repair can occur and the body can make sense of other biorhythms it's been given, whether it's from its PT, the chiropractor, the pharmaceutical drugs start working again, their stretching regimen starts to work again. They're able to have a conscious conversation with a colleague or a partner and be able to really help themselves.
Now, another question, you brought it up too, I kind of tell into it, is that there needs to be an intersection of the policy and government part, right? Just to get, they had to get Class 2 needles. And now I see that you're actually actively engaged in chamber. And so can you talk about the policy and the advocacy part that you have to do in regards to, your line of work?
Sure. Thank you for bringing that up. So, there's like anything, right? We kind of always have to go back to money and politics because that's the way our world works. That's the way our economy works. That's the way our society works. And to be fair, in our even this is a traditional medicine that's been around for thousands and thousands of years, it's really still in its infancy here in the United States. And each state in the USA has successfully made its own country for laws and legislation in their practice acts of how acupuncture is seen and recognized in the greater medical system there in the state. Here in Virginia, I'm on the board for advocacy for acupuncture, as well as on a national level of making sure that our states communicate. Our students are exposed to that and understand that's part of the profession. You have to be an ambassador to help people understand how this can help and why do they need to come and try acupuncture, as well as informing your colleagues, as well as working in policy, because with the policy, that allows it to be practiced legally. It allows the expansion of scope. The original term for doctor is teacher, the original translation in Greek. And so I always try to remind my students that we have to be those teachers that help people understand what are we doing, and then we need to get that written in law. You brought up just earlier about my colleagues recognizing me as a legitimate medical provider, and most colleagues do. There's a very different practice when it comes to clinical collaboration and then legal collaboration. And so that playing field often needs to be funded for, lobbying efforts, or at least like being able to work together collaboratively. Clinically, I don't think anybody has a problem working together. I like working with all medical providers. I really enjoy learning from other medical providers, and I hope so vice versa. But when it comes to a legal landscape, it usually takes numbers of people lobbying for a certain movement, whether it's a national bill to have Medicare cover acupuncture.
What are the data points that you need to when you lobby to say like this works, should be covered by Medicare? What are some of the points that you need to say, like, advocate for, because or the proponents or the opposition of what
Oftentimes it's cost savings, and with preventative type medical services, we usually are not going to make you money, but we're going to sure as heck save you a lot of money. And if you consider being the patient, from the patient point of view, we're going to save you a lot of like backache, both figuratively and literally. We're going to save you on that runaround, and we're going to give you the ability to enjoy your quality of life and whatever definition that would be. So a lot of the time, patients, from the patient point of view, will not seek out services that are not covered by their insurance. Now, insurance is a third party that's, you pay insurance money every month to have coverage. Well, if it'll cover PT but not acupuncture, if it'll cover medical prescriptions but not acupuncture, there again, it's going to maybe factor in your decision as a consumer. From that bigger level, how do you lobby those insurance companies? Well, it's supply and demand, right? We learned that in Economics 101. Well, how do we have demand? Well, people need to want to have acupuncture. They need to ask for it, right?
Testimonials and stuff.
Testimonials. And I think at this point, there's no doubt in most people's mind. They maybe don't want needles, but they never had our little acupuncture needles. Yeah. There's no doubt that it works. It wouldn't be around for thousands of years if it didn't work. But how do we work the system? And a lot of acupuncturists don't understand the legal system, or we're still small in formulating our groups of people to lobby for these types of bills to be passed. Now, there is a bill going through on a national level for Medicare, and Medicare is typically going to cover acupuncture services with acupuncturists written in as legal providers to then offer services for low back pain. What's so interesting, and I found this out at a conference just recently, is that the acupuncture industry here in the United States is a $600 million industry. But with a passing of a bill where Medicare would cover acupuncturists and recognize acupuncturists as legitimate providers, just for one code, which is low back pain, we would be a $7 billion industry overnight. And there would not be enough acupuncturists to meet the need or that demand for treatment. Now, with that, acupuncturists want to help. I don't think any doctor in any medical discipline goes into medicine without that deep need of wanting to help others, right? We have that service orientation. We've been called to help and through the medical lens. So I believe that we really just want better access to our patients, being able to provide care, and then thus being compensated for it. Because as much as I want to pay my taxes in hugs, we know how that goes.
Yeah, exactly. Now, one thing I thought about too is then the new wave of training. So where do typically future acupuncturists come from? Like typical majors, they biology students, chemistry students. When you think of pre-med, right, they're usually biology, chemistry, whatever. So, but maybe for acupuncture, maybe on the body, is it more like, kinesiology or some other field? Where do you think you see a lot of them?
So that's one of the most fun parts about working at an educational institution. We have such a diverse student body. Now, most of them, I will say, have come to school because they had that deeper calling. And where that calling came from, it was either from what I call a conversion moment where they were helped so drastically by acupuncture, or maybe a family member or a child who was significantly had a significant illness, and acupuncture was the last resort. It helped them so much, and now they want to help others. But our student body is quite diverse in that a lot of them already have a medical background. Perhaps they are medical providers, they're, massage therapists, physical therapists, nurses who wanted to add to their practice. They understand that their mode of medicine works phenomenally. But then there was always still that little piece of the pie that they could help out a little bit more. And as you do when you go into a profession, there's always a continued education of the figuring out what's the next layer. How can you get deeper and deeper into the root cause? We do have quite an interesting segment of our student body that are just second career. They were maybe government workers who were just so tired of being stressed out. They wanted to come into this medicine. They are potentially, bankers, or they were school teachers, and so that they had that thing that called them into the medicine. And so they're continuing to learn for their own benefit, as well as ultimately to have a practice on the side one day and be able to serve their community.
Yeah, and another question too, like just more like the levels. Is there a certain requisite to get in that you already need to have a high school degree or bachelor's to start, or and you say you had some career switchers. So what is if I'm a high school kid talking about future dreams, how could I, what steps do I need to take to at least start studying acupuncture?
Well, that is a great question. Typically, the requirement is an associate's degree. So, and you have your basic courses already knocked out. There are several. Our first year or two of our educational program is mostly online, and it's mostly like the prerequisites for a nursing program where you learn your basic Western medical. But from there, you then transition over into more the theory of traditional East Asian medicine, as well as in the practical component of being on site and practicing on patients. Okay. Now, that always scares people, like, I don't want to be a guinea pig for students, but in fact, those students have already gone through all of their techniques courses. Those students are not only starting out in the clinic as an observer, they go on to be a secondary assistant intern to then be the primary treating intern that's still overseen by a licensed supervisor. So it's a very rigorous process, and it's almost much like the martial arts tradition of learning through doing, and they really get a feel for and to get acclimated into the medicine. But when students come and are interested in school, I would say first and foremost, check us out on our school website. They can then email one of the admissions officers and just ask their preliminary questions. They would send their transcript over. Some students do already receive transfer credit for courses that have been completed in their past. Say they were pre-med or, you did your basic science courses. But then that's really individualized. Much like the medicine, it's very individualized how a student continues to progress through their educational program. A lot of our students are working professionals or maybe have a small family. So with that, they take a course load that works with their current lifestyle. Ideally, we'd love to get our students in and out in the 3.5 years that they may take to complete all their courses, with that additional year for their doctoral degree, a professional doctoral degree. So there are many different ways in which a student can go through, depending on their current setup for their life and how supportive their partner would be for helping out with childcare and paying the bills. They can do it as quickly as 3 years.
And then for the doctoral part, do they have to do a thesis or a project? How do they compilate? What's the compilation to get, or criteria to get the doctorate in acupuncture?
Right. So we're one of those unique professions as well. Our master's degree is already about 3.5 years. So we have what's called a professional doctorate, which is an additional 1 year of coursework. Now, there's a DAOM program. And it's skipping my mind of what that even stands for. It's like the highest level. It's like the highest tippy top level of education for East Asian medicine. And that's where you'd go through and do research and write a dissertation. Now, that's a 2-year program, and that does have an extra clinical component along with it. Some students continue to want to aim for that. They typically go on into research, something like that in the field. But to get the doctoral designation, they would need to complete that 4th year of the professional doctorate program, which is 4 continued programs of a deep dive into anything from orthopedics, women's health issues, cancer care, and then practice management, advanced practice management.
And so I'm thinking about, I'm getting my doctorate now. Is there, when they do their research, do they sometimes research like a cross-disciplinary study, like, acupuncture as it relates to, some cultural aspect or something like that?
Yeah. So that's the coolest part about research is like they're the innovators of where our worldview is going. And so we've had many research projects that we actually, it's so cool to come to work every day. And we have like one of the superstars in our profession, Dr. Li-Xing Lao, who was one of the original researchers here in the U.S., who did the very first study on osteoarthritis in the knee. Now, it can become a lot more interesting through those cross-cultural studies, the meta-analyses that can go on in interdisciplinary type research. But the student finds their passion and really dives into that. And that's part of the reason why it's such a designated title there at the DAOM is that they go through years of working with interdisciplinary colleagues, going down into the nitty gritty, doing their own clinical research, and then writing up the dissertation, which is a very big thing, a big bite to chew off, which I'm sure you know. And ultimately, not every person wants to go into that vein. They want to go and help patients and go into clinical practice. They maybe want to go into education. Maybe they want to go into advocacy. So that's the beauty of our profession is we have so many different styles of practice. We have so many different avenues for really going into helping the profession. And that's where we try to be the hub for students to find their calling and refine it to really give them a laser beam light of where they'd like to go next.
And what do you think, put on your crystal, you're looking at the crystal ball, you don't put the crystal ball on your head, but looking into that, what do you think the next 5 years of this field and this study is going to look like? You're already talking about growth and all that stuff. Like, what are some of your thoughts for the future?
Yeah. So, if I put the crystal ball in my head, I'm actually very, very optimistic and very excited. So I was probably in that second wave of practitioners here in the country. I think the students today have so many doors opening for them in the next 5 years, whether it be employable by hospitals, adjunctively in clinics that are collaborative with other healthcare providers. I see more and more research being done on neurology and helping with the brain-body connections. The gut health is huge. Also working with mental health. So we really recognize this, or it became far less taboo to talk about mental health after the pandemic. But we see how like the youth struggle with this so much, as if growing up isn't hard enough as it is, right? But then the modern pressures that continue to be upon us, the ever-changing world, the information age. So how acupuncture can help be another support system for someone to navigate all these different changes. We come into life in really exciting times when we have AI and how that can help with cross studies on say even like precipitating factors to health and how acupuncture can intervene sooner rather than later to help with health outcomes. The VA, the Department of Veterans Affairs, has adopted the whole health model a long time ago and how we can help more and more of the patients that they treat, as well as employ that model across our system to really factor in physical health, mental health, emotional health, and all the different bubbles of health that we define for our best life.
All right. Well, that was great. I think we could keep on going. So we're going to go to the part of the show called Shot for Shot.
Shot for Shot.
Yeah.
Do we have tequila?
No. I was going to pick bourbon anyway. So this is where you get to ask me any random question. I get to ask you any random question. You want to go first, or I'll go first?
How'd you pick your child's names?
Okay. Say that again.
How did you pick your child's names?
All right. Okay. So Bennett is my first and Miles is my second. Bennett Taylor Wilkerson. So Bennett... so I always got this. My name is Philip Linwood Wilkerson III. I did not go with Philip Linwood Wilkerson IV because I thought that was kind of, or just like, yes, pompous and elitist and just sound like royalty or something so my dad was disappointed about that. But also I blame my dad because my dad never gave me a nickname. Like no one ever called me Trey or anything. Like I'm Phil or Philip. My dad was Big Phil. I'm Little Phil. So that was already off the table. Like I was not naming him Philip. So when we thought about Bennett and Taylor, we wanted to respect my mother and my mother-in-law's family because, like when women, they lose their last name, I told my dad, you already won. You got 2 Wilkersons, whatever. So the Bennett is after Joan, like she's the Bennetts somewhere there. And Taylor is after my mom. That's my mom's mother's maiden name, Estelle Taylor. So we did Bennett Taylor Wilkerson. Now for Miles, the Miles really didn't mean anything. His name is Miles Jeffrey Wilkerson. So Miles, I just liked the name Miles. We liked it, like Miles Davis or something like that. But Jeffrey is named after Jeff Kirsch, my father-in-law who recently passed away. So we did Miles Jeffrey Wilkerson as ways to kind of like honor people that didn't, like Jeff was like, what about me? My name's not in there. Joan had her name. My mother got her representation. All the grandparents did. And then my dad's like, what about me? It's like, you got Wilkerson. You won all of it, right? All 4 boys are Wilkerson. So that's kind of that. Miles Jeffrey Wilkerson, Bennett Taylor Wilkerson.
Awesome. Can I comment on that?
Yeah.
I love how you respect the ancestry, because something that we, I think, do a really poor job here is honoring the tradition and where we came from to be here today. And so much of who we are all those struggles we went through, or all the things that our family has gone through that has made an imprint on us and really orients us on where we need to head and how we imprint on our children and how we continue to like make an impression on the world.
Well, I mean, my dad always impressed this. So he says, when you die, you don't take nothing with you but your name, right? And so names are very important. I think one exercise I like that you act at, like we always, we do icebreakers, but one thing I was always saying, is there something special about your name? And then people be like, oh, no, my name's just something like Jessica. But I said, why? And everyone has a story to their name, whether it's their family or some random, combination of a name they put together. So I'm glad you brought that question.
I got to tell you one more thing. So
okay.
give me the microphone. So in culture, right? So many. It's one of the social glues that we had was storytelling, and then people's name. And there was one of the tribes I used to study in their ethnography talked about you have 3 deaths: a death when you pass from this world, a death when people stop remembering who you are, and the last time your name is said. So to your point of how powerful the name is.
Well, then your name's being said, that means you can get your name in books and stuff because people leave your legacy. Oh, gosh, that's pretty deep. 3 deaths. Well, I would just say, Philip, this is digitally. My name will live on. So my question for you is, UVA, that's where you went to school, right? If you could go back in a time machine, would you have still gone to UVA? Or the second layer of this, if you also would have went to another school, would you still have studied religious studies and anthropology? I love that.
Wow, that is a great question. So, I made the best decisions for myself at that time. And I don't know if I could go back in time had I thought any differently. Time is so precious, and it's the one resource we can never get back, right? So I often do think now, where I see how precious time is and how I wish I had more time to go to the gym or walk my dog or spend time with the people I love. I often think back of like, man, how much time we waste. And even if it's just send a little quick text to say, hey, I love you, or, do a little part-time study or self-study, read a book on biophysics and, quantum physics or something. So if I look back I could have gone some other routes as far as like, I love studying people and patterns. So I would think like criminology could be a way of like learning people's nuances and how that factors into our operations daily. Always psychology and how the brain works, because we're such algorithms that we don't even realize it. But ultimately, I feel in my heart that I came to some really profound conclusions for myself studying religion and anthropology. And so I really think that has defined me and who I am. And I am really eager to see, like, kind of retrospectively in the next decade, like how much I continue to grow and what I do. But with that, I think we're always continued learners. And funny enough, at UVA, we call one another, rather than freshmen, we call each other first years, because Thomas Jefferson realized that you are embarking on the future of forever learning. And I guess I took that to heart. I didn't want to be like one of those people that had to be like all UVA, but we are always learning. And whether it's learning from one another, whether it's learning from our students and them really pushing our buttons, our children that like make us realize parts of ourselves we didn't want to face, like there's always a layer of learning. And if we can approach that with a consciousness of understanding there's always more to learn, then we can continue to grow and maybe leave that legacy that we're looking to leave one day.
Okay, I had one follow-up question. So when you got there on campus, was that your first major or you switched a bunch? you cracked it, because I switched majors, so history, and no one picks history on their own, but did you like crack the book and say, I want to study this?
So when we were at high school together, there was I took an elective in anthropology, and I was so fascinated by that. I knew I wanted to study anthropology. Interesting way I fell into religious studies is I did come from a Christian family, and I was very curious of like, what is life, and what is the meaning of life, and what is the afterlife, and am I going to die? Of course I'm going to die, but having my own questions. And so I took a class. I had this opening, and it just so happened with my athletic schedule and everything that it fit in the time. And it was a class on the New Testament, and the professor was so profound and so interesting. And the way that they were teaching religion was very different than Sunday school. Right. And, the way they were teaching it as a historical book and a movement, and these people were historical figures, and how that fit into the bigger cultural context at the time, and what were the precipitating factors for certain things to be discussed in that time frame. So I really found all of that to be so interesting, and then how it continued to evolve and overlay into other movements of humanity at the time. I knew that was where I was continuing to be curious and continuing to grow.
Well, shout out to that religious studies teacher, because same thing. You get one good professor and you're like, I'm switching. I'm history major. So this is the part of the show I'll call it this, we're landing the plane. Shout outs and plugs. So show love to anyone you want to show love to, and then plugs. These are things I'll put in the show notes, things that you want the viewers and the listeners to be aware of.
Okay, cool. Well, I have to say shout out to my team here at VUIM. I legitimately love all of them, and they put up with me as a coworker and a friend. So James Lee is our Director of Strategic Initiatives, and he helps keep me in that vector, like I say all great teachers do. Shout out to our CEO, John Yu, who always reels me back in and calms me down, gives me opportunities to go and teach. As far as plugs, we have social media, so you can follow us on our VUIM clinic or our Virginia University of Integrative Medicine sites. You can also follow me personally, but I am one of those people that doesn't really pay attention to social media. I always love it if I have followers and stuff, but you're not going to be very interested. And then be sure to check out any articles that we work on and publish. Also, continue to look for our students. If you ever see a VUIM graduate, you know that they have come from an amazing university. We have over an 85% pass rate for our board exams. They are the top of the top when it comes to licensing. They are versed in business practices. They're empathetic practitioners. I usually scold them if they're not. So they're definitely getting the total package here, and we would look forward to seeing all of them be successful. And we would look forward to all of your viewers who are interested in coming in for an acupuncture treatment. Let us know that they heard about us through your podcast, and we can look to arrange treatment for them.
Excellent. Well, thank you so much, Haley, for this wonderful conversation. I think I learned a lot. I learned some new things about you. Positive Filter listeners, if you're listening to this or watching this, please consider donating to the Jeff Kirsch Anti-Hunger Fund. As you know, every episode is dedicated to the memory of my late father-in-law, Jeff Kirsch, who I love dearly. Also, if you're part of the Mason Nation and go to Mason, please consider submitting a Pats for Patriots. It's a way to show small kindness and acts of kindness to everyone around Mason. Please check out everything that Haley's doing and all her colleagues. Thank you so much for watching and listening, and we're out. Thank you for listening to Positive Filter, a podcast that focuses on family, friends, career, with a little self-help along the way. If you enjoyed this podcast, please share it with your family and friends, and like the Facebook page, Spreading Positivity of Movement. Thanks for listening.